Hi there. Hope you all are doing well. Uh, we're back from vacation. Um, it's really good to get away. This week, though, I've been in my professional reading. There are now in the mental health world, we're starting to come up with a label for all this stuff we've gone through. I think it's one group has called it the pandemic trauma and stress experience. So now we got PTSE. It doesn't really matter. I mean, you can call it asparagus for all I care. Um, the fact is, and we've been talking about this on the blogs and amongst my colleagues, about the fact that we're going to have a mental health crisis. We already have it. It's only going to get worse. If you listen to the media now, they have actually starting to report on suicide rates amongst healthcare providers, burnout, PTSD, all those kind of things. Healthcare providers quitting their jobs just because they're burnt out. So to think that we're kind of going to get back to normal and this is all going to disappear. Any people who've been through combat or mass casualty incidents, things like that, know that usually what you're doing is you're doing your job, you're doing what you got to do, and that isn't where the real mental health issues come up, that they come up afterwards. And I believe that this is going to be true for this pandemic as well. That yes, we have all these things going on, and there's an accumulative effect, but things are going to get quote worse before they get better, I believe. Um, so what do we do about it? I mean, I don't mean to be so negative. It's usually the resiliency skills, and the biggest protective factor is maintaining a healthy social support system. So even though you may have to do it with Zoom, but as we begin to move out of this pandemic, it's important to really maintain those relationships. Also, your belief systems. You've heard Mike Grill talk about that. So there are things we can do, but it is coming, and part of what we can do is embrace the fact that we're all going to experience this at some level. So practice the skills, acknowledge when you're struggling, reach out to people, and it's good to be back. See you next week. Bye.